We are back today with Catherine Sevier from the Generations Study Group and AARP and Steve Edmonds from Alliance Insurance Services. Thanks so much for being here, you two. The first question I want to ask you, and I'm going to ask this to Catherine, explain what Medicare is and how it's different from Medicaid.
So Medicare is the insurance that is provided by the government for people from the age of 65 on, and also for people who are eligible for medical disability and who've applied for it. And Medicare covers all of our overarching health issues. It has a hospital plan, which is Part A. It covers physician office visits, things like x-rays and that type of thing. That's Part B. And then there is a Part D coverage, which is around drugs and pharmaceuticals. Now, some people are in a plan that's called Medicare Advantage, and that's considered a Part C plan, and that is more of a managed care plan. But in all cases, that is what is covered. It doesn't mean they pay 100%. There are deductibles with the various things in the plan. So you have to understand that it becomes your insurance at 65, but it doesn't cover everything that you may need. So you have to really learn about the plan.
And Steve, if you could explain the difference between Medicare and Medicaid.
So Medicare is like Catherine said, you're going to be eligible for it at age 65 and for those under 65 with disabilities. And Medicaid is basically a coverage that a lot of times people 65 and over have, but it also people under 65 can be on Medicaid, and that's Medicaid usually is covering those that are in a lower income according to the federal poverty level, where their assets and income do not add up to certain amounts. Then the federal government steps in and provides coverage for them under Medicaid.
Got it. Okay. Catherine, we talked about this during the commercial break. It's so important to make sure that you know the deadlines, right?
Absolutely. So the most important thing anyone who's approaching their 65th birthday should know is that it's important for you to sign up for Medicare within 3 months before your 65th birthday, the month of your birthday, or 3 months afterwards. Doesn't necessarily mean if you're working and you have other insurance that you have to take your Medicare at that point, but you must sign up, because if you do not, when you go to sign up later, you may have to pay a penalty, and that penalty is significant and it is for your lifetime. So imagine getting a 10% penalty because you didn't sign up on time, and that 10% gets billed to you for the rest of your life when you are paying for parts of your Medicare.
Are you surprised, as I am, that it's such a significant penalty forever? I mean, why do they make it so difficult in case you miss your deadline?
That's a mystery, but it is a deterrent. And as a result, I think they do a better job of getting people to sign up. But it is a significant enough penalty that it's really important for us to get that news or that information to people. And people don't think about it until they're getting close to that 65th birthday. And now it's disconnected from the time that you're eligible for full Social Security. So it makes it even more complicated.
Steve, people have been texting us questions. One of them, someone's wondering, does it mean that Medicare cost goes up in cost? I think they're referring to if this Inflation Reduction Bill passes.
Well, a lot of stuff makes healthcare go up, and regardless of one bill or not, it's probably going to go up anyway. It's like everything else is going up. But yeah, that that is one of the things that you have to consider. In our earlier segment, you were asking about why one party or another might be against that, and I guess that would be probably one of the things is, how do you pay for that, and will it make taxes go up and other things that we pay? So that is one consideration. Does the good outweigh the bad? That's the question there. So,
But it
yeah,
sounds like we won't know that answer until we get to that point, right?
sounds like, yeah.
Okay.
I think for the individual, though, who goes from having $7,000 out of pocket to 2,000 in a year, that will be they will see that improvement immediately, but the overall cost of it will be calculated over the next years.
Okay, Catherine, Steve, I misspoke before. I said we had one segment down and one to go, but we actually have another segment to go. So thank you for being here. We will be right back answering your questions.